Hello everyone, Dr. Alan Mandell here. Welcome back to my channel, Science of Healing. If you're over 60, this may be one of the most important messages you will ever hear. A heart attack can happen suddenly, quietly, and often when no one else is around. But the good news is, your actions in the first few minutes can dramatically increase your chances of survival. Today, I'm going to share 7 scientifically supported life-saving steps every senior must know, plus daily foods that strengthen your heart and lower your risk. Let's begin. Imagine this. You are alone in your home. The phone is in the other room. Your chest feels tight, like someone is sitting on it. Your breathing becomes shallow, and in that moment, your brain whispers a dangerous lie. It's probably nothing. But what if it's not nothing? What if your heart is starving for oxygen, and every second you wait, millions of heart cells are dying? Medical science tells us that during a heart attack, nearly 2 billion heart cells can be lost in just 30 minutes. Once these cells die, they never come back. This is why doctors say time is muscle. The longer you wait, the weaker your heart becomes for the rest of your life. Many seniors believe heart attacks always feel dramatic and obvious, like in the movies. But research shows that up to 50% of heart attacks in older adults are silent or mistaken for indigestion, fatigue, or anxiety. Some people feel only jaw pain, back pain, nausea, or extreme tiredness. Others feel pressure, fullness, or discomfort in the chest rather than sharp pain. This is why recognizing early signs is the first life-saving skill. Your heart is a powerful pump, beating more than 100,000 times every day, but it depends on tiny blood vessels called coronary arteries. When one of these arteries becomes blocked by a blood clot, the heart muscle begins to suffocate. Within minutes, the muscle weakens. Within hours, permanent damage occurs. And within days, heart failure can follow. Studies show that nearly half of people who die from heart attacks never reach the hospital, not because treatment doesn't exist, but because they waited too long to seek help. This is why calling emergency services immediately is the most important action you can take. Modern medicine has extraordinary tools: clot-busting drugs, stents, angioplasty, and emergency surgery. But these treatments only work if they are given early. The first hour after symptoms begin is called the golden hour. Survival rates are dramatically higher when treatment begins during this window. One large study found that people who called emergency services within the first hour were twice as likely to survive compared to those who delayed. Yet many seniors hesitate. They worry about bothering others. They worry about embarrassment. They worry about cost. But no worry is greater than losing your life. Your brain during a heart attack can become confused and underestimate danger. This is a survival instinct gone wrong, but you must override it. If you feel chest pressure, shortness of breath, unexplained sweating, nausea, or sudden weakness, you must assume it is serious until proven otherwise. Think about this. Paramedics can begin life-saving treatment the moment they arrive. They carry oxygen, defibrillators, medications, and equipment that can restart a failing heart. If your heart stops, they can shock it back into rhythm. If you drive yourself, there is no one to save you if you collapse on the road. Heart attacks are not just about pain. They are about time. Every minute without oxygen increases the risk of death and disability. This is why doctors emphasize immediate action. There is also a powerful psychological truth. People who survive heart attacks often say they knew something was wrong, but delayed. They ignored the warning signs. They waited for symptoms to pass. And that delay changed their lives forever. Your heart does not send warnings by accident. Chest discomfort is not always dramatic, but it is meaningful. Your body speaks in signals. Learning to listen is a survival skill. Even if it turns out to be a false alarm, you lose nothing by calling for help. But if it is a real heart attack, you gain everything. Research shows that seniors who recognize symptoms and act immediately have significantly lower rates of heart failure, disability, and death. Early treatment can restore blood flow, limit damage, and preserve your quality of life. Imagine being able to walk, breathe, and live independently for years because you made one fast decision. Imagine the opposite, needing oxygen, medication, or assistance for the rest of your life because you waited. This is why education is power. Knowledge is survival. Heart attacks do not wait for convenient moments. They happen during sleep, while watching television, while cooking, or while resting. Being prepared mentally is as important as being prepared physically. Keep your phone nearby. Know your local emergency number. Teach your family and friends the signs. And most importantly, trust your instincts. Your heart is your life engine. It has carried you through decades of experiences, memories, and love. When it sends a distress signal, it deserves immediate attention. Remember this: recognizing the signs and acting fast is not fear. It is wisdom. It is courage. It is self-respect. Your life is worth one phone call. Your heart is worth 1 minute of action. And your future depends on what you do in that critical moment. Do not wait. Do not doubt. Act fast. Because in a heart attack, every second is a heartbeat you may never get back. In the middle of a heart attack, your body becomes a battlefield. Your heart is struggling. Your brain is confused. Your instincts are fighting against fear. And in those moments, what you do or fail to do can determine whether you live or die. Most people believe survival depends entirely on doctors and hospitals, but science shows that what you do in the first minutes can dramatically change your outcome. These simple actions can slow damage, stabilize your heart, and buy precious time. One of the most powerful emergency tools is something many seniors already have in their home: aspirin. Aspirin works by preventing platelets in your blood from sticking together. During a heart attack, a blood clot blocks an artery feeding the heart. Chewing a regular aspirin tablet allows it to enter the bloodstream faster, helping to stop the clot from growing. Research from major cardiology organizations shows that early aspirin use can reduce mortality by up to 23% in suspected heart attacks. That tiny tablet can mean the difference between a small injury and a fatal event. But aspirin is not the only weapon you have. Your body's stress response during a heart attack can be deadly. When you panic, your heart rate skyrockets, your blood pressure rises, and your heart demands more oxygen. Exactly what it cannot get. This is why staying calm is not just emotional advice, it is a medical strategy. Studies show that acute stress increases the risk of dangerous heart rhythms and sudden cardiac death. When you slow your breathing, you activate the parasympathetic nervous system, lowering heart rate and blood pressure. Even a few slow breaths can improve oxygen delivery to the heart muscle. Sitting or lying down in a comfortable position also matters. Standing or walking can strain the heart. Sitting upright with your back supported reduces workload on the heart and lungs. Loosen tight clothing, especially around the chest and neck, to make breathing easier. Another shockingly simple step can save minutes that feel like hours. Unlocking your door. If you collapse and paramedics cannot enter your home, valuable time is lost. Heart tissue dies minute by minute. Unlocking your door and keeping your phone nearby is a silent act of survival. For seniors who have been prescribed nitroglycerin, this medication can be life-saving. Nitroglycerin relaxes and widens blood vessels, improving blood flow to the heart. It has been used for more than a century and remains a cornerstone of heart attack treatment. When used correctly under medical guidance, it can relieve chest pain and reduce strain on the heart. But one of the most dangerous mistakes people make is trying to drive themselves to the hospital. During a heart attack, blood pressure can drop suddenly, the heart rhythm can become unstable, and fainting can occur without warning. Driving under these conditions can lead to fatal accidents, endangering you and others. Emergency responders are trained to treat heart attacks on the way to the hospital, something no private car can provide. These actions may seem small, but they create a chain of survival. Every minute gained means more heart muscle saved. Every breath slowed means less damage. Every decision matters. Here is a shocking fact. More than half of heart attack deaths happen before reaching the hospital. Not because medicine failed, but because time was lost. People hesitated. People underestimated symptoms. People waited. Your heart is a biological engine that never stops working. When blood flow stops, the engine begins to fail. Within minutes, heart cells begin to die. Within hours, scar tissue forms. That scar tissue cannot pump blood. This is how heart failure begins. But when you take immediate action, you interrupt this process. Aspirin slows clot growth. Calm breathing lowers oxygen demand. Nitroglycerin improves circulation. Emergency responders restore blood flow. Each step stacks the odds in your favor. Medical research shows that early intervention can cut heart attack damage by more than half. This is not just about survival. It is about quality of life. It is about being able to walk, breathe, and live independently. Imagine two futures. In one, you ignore symptoms, panic, and wait. In the other, you act immediately, stay calm, and call for help. The difference could be decades of healthy life. Your brain may try to convince you that it is indigestion, stress, or fatigue, but your heart does not cry, wolf. When something feels wrong, it often is. Preparation is power. Keep aspirin in your home if your doctor approves. Learn breathing techniques. Know where your medications are. Keep emergency numbers visible. These are not just tips. They are life-saving strategies. There is a powerful psychological element here. During emergencies, people freeze. They forget what to do. This is why learning these steps now can save you later. Your brain remembers training under stress. Every senior should mentally rehearse these actions. Picture yourself feeling symptoms. Picture yourself chewing aspirin, sitting down, unlocking the door, calling for help. This mental practice can reduce panic and improve reaction time. Your heart has carried you through childhood, adulthood, and into later life. It has beaten billions of times. It deserves immediate protection when it cries for help. Remember this truth. You are not helpless during a heart attack. Your actions matter. Your decisions matter. Your courage matters. A heart attack is not just a medical event. It is a race against time. And in that race, you are not powerless. You have tools, you have knowledge, you have control. When you act fast, you become your own first responder. You buy time for doctors to save your heart. You protect your future. One decision, one breath, one tablet, one phone call. These small actions can change everything. Your life is worth preparation. Your heart is worth protection. And your future is worth every second you fight for it. Do not underestimate the power of simple actions, because in the silent moments of a heart attack, they can be the difference between life and death. Your heart does not fail overnight. It is shaped by thousands of choices made quietly, day after day, meal after meal, breath after breath. Long before a heart attack strikes, your arteries have been sending whispers, tiny warnings that most people never hear. Science now tells us that more than 80% of heart attacks are preventable. That means the future of your heart is not written in stone. It is written on your plate. Imagine your arteries as highways delivering life to your heart. When those highways become clogged with cholesterol, inflammation, and sugar damage, blood flow slows. The heart begins to starve. And one day, a single clot can shut everything down. But the same science that explains this danger also reveals a powerful truth. Food can heal, protect, and even reverse damage inside your arteries. Let's begin with fatty fish. Salmon, sardines, and mackerel contain omega-3 fatty acids, some of the most studied heart protective nutrients in medical research. Omega-3s reduce inflammation, lower triglycerides, stabilize heart rhythm, and prevent dangerous blood clots. Large population studies show that people who eat fish regularly have up to 36% lower risk of dying from heart disease. These fats literally make your heart's electrical system more stable, reducing the risk of sudden cardiac death. Then there is garlic, a humble bulb with extraordinary power. Garlic contains allicin, a compound shown to lower blood pressure, reduce cholesterol, and improve blood vessel flexibility. Clinical trials have found that regular garlic consumption can significantly reduce systolic blood pressure, sometimes comparable to mild medications. In a world where high blood pressure silently damages arteries, garlic becomes a natural shield. Now, think about oats. A simple bowl of oatmeal in the morning may look ordinary, but it contains beta-glucan fiber, a substance that binds cholesterol in your digestive system and removes it from your body. Research shows that eating oats can lower LDL cholesterol, the so-called bad cholesterol, which is directly linked to heart attack risk. Every spoonful is like sweeping debris out of your arteries. Leafy greens like spinach, kale, and arugula are another secret weapon. They are rich in nitrates that the body converts into nitric oxide, a molecule that relaxes blood vessels and improves circulation. Nitric oxide is essential for healthy arteries. Low levels are associated with heart disease, erectile dysfunction, and stroke. Eating leafy greens literally helps your blood vessels open and breathe. Berries may be small, but their impact is enormous. Blueberries, strawberries, and raspberries are loaded with polyphenols and antioxidants that fight oxidative stress. Oxidative stress damages artery walls and triggers plaque buildup. Studies show that people who eat berries regularly have lower markers of inflammation and improved blood vessel function. These tiny fruits act like armor for your heart. Nuts such as almonds and walnuts provide healthy fats, fiber, and magnesium. Magnesium is essential for heart rhythm and blood pressure control. Large studies have found that regular nut consumption is linked to reduced risk of heart attacks and sudden cardiac death. A small handful of nuts can support your heart's electrical system every day. Olive oil, especially extra virgin olive oil, is a cornerstone of the Mediterranean diet, one of the most heart-protective eating patterns ever studied. People in Mediterranean regions have significantly lower rates of heart disease, and olive oil is a major reason. It contains monounsaturated fats and powerful antioxidants that reduce inflammation and improve cholesterol balance. Some studies show that replacing butter or processed oils with olive oil can dramatically lower cardiovascular risk. But heart health is not just about adding good foods, it is also about removing the silent enemies. Ultra-processed foods, sugary drinks, refined carbohydrates, and trans fats damage arteries, increase inflammation, and disrupt cholesterol. They create spikes in blood sugar that injure blood vessels, leading to plaque buildup. Research shows that high consumption of ultra-processed foods is associated with increased risk of heart attack, stroke, and early death. Sugar does not just affect weight. It stiffens arteries, increases triglycerides, and promotes dangerous fat deposits in the liver and heart. Trans fats, often found in fried and packaged foods, are so harmful that many countries have banned them because they dramatically increase heart disease risk. Your heart is a living organ that responds to what you feed it. Every meal sends a message to your arteries. Every bite either heals or harms. Imagine waking up at 70, 80, or 90 with a strong heart, clear mind, and energy to enjoy life. That future is built with small daily choices: a bowl of oats instead of sugary cereal, fish instead of processed meat, olive oil instead of margarine, berries instead of dessert. These are not just dietary preferences. They are life extension strategies. One long-term study followed people for decades and found that those who followed heart-healthy diets lived longer, had fewer heart attacks, and maintained better physical and cognitive function. Food is not just fuel, it is information for your genes, your cells, and your arteries. Your heart muscle can strengthen, your arteries can become more flexible, your cholesterol can improve, inflammation can decrease, all through what you eat. This is why doctors call lifestyle the first line of defense against heart disease. Medication helps, but daily habits shape your destiny. Think of your heart as a loyal companion that has never stopped working for you. It beats while you sleep. It beats when you laugh. It beats through stress, joy, and sorrow. It deserves nourishment, not neglect. Every senior has the power to rewrite their heart's future. It is never too late to start. Studies show that even people in their 70s and 80s can improve cholesterol, blood pressure, and arterial health through diet changes. Your body is resilient. Your heart is adaptable. Your future is flexible. When you choose heart-healthy foods, you are not just preventing a heart attack. You are preserving your independence, your memories, your time with loved ones. Food is a daily vote for the future you want. A future where you breathe easily. A future where you walk without pain. A future where your heart beats strong for years to come. Remember this, your heart attack risk is not only determined in emergency rooms, it is determined in kitchens, grocery stores, and daily routines. You hold the power in your hands, on your plate, and in your choices. Your heart is listening. Feed it wisely, protect it fiercely, and let every meal be a promise to live longer, stronger, and healthier. Because the most powerful medicine is not always in a pill. Sometimes it is on your fork.